Here we will be talking about Part Q and risk stratification. Part Q is a physical activity readiness questionnaire and indicates to the trainer that a client's readiness for physical activity. The questionnaire consists of 7 questions. If the client answers yes to any one of the questions, the client should consult with their doctor before proceeding with any exercise or fitness analysis. If client answers no to all the questions, then the client can become more physically active and the trainer can proceed with fitness analysis. Risk stratification or risk factors for coronary artery disease. These include age, family history, cigarette smoking, sedentary lifestyle, obesity, hypertension, dyslipidemia, prediabetes, and high serum, high density lipoprotein cholesterol. A person who is of low risk meets 0 or 1 of the CAD risk factors and are generally younger individuals. Moderate risk people meet 2 or more of the CAD risk factors and are generally older than men over 45 and women over 55. A client that is high risk for coronary artery disease are individuals with known cardiovascular disease or pulmonary disease. They often have one or more one of these signs or symptoms: heart murmur, unexplained fatigue, dizziness, swelling of the ankles, fast or irregular heartbeat, unexplained shortness of breath, intermittent lameness or pain in calf muscles, breathing discomfort when not in the upright position, could be interrupted breathing while sleeping, sleep dyspnea, or pain or discomfort in jaw, neck, chest, arms, or elsewhere that could be caused by. For low-risk clients, these are people who answer no to all Part Q questions, asymptomatic with 0 or 1 risk factor. This client is okay to experience an increased physical activity. They do not need current medical examination or exercise prior to moderate or vigorous exercise. And you do not need a physician supervision for submaximal or maximal exercise testing. Starting with the blood pressure test, you would find out if it's over 144 over 94. Consult with a doctor before proceeding. Start slow and gradually build up. This is the safest way. It is okay for this client to become much more physically active in their daily lives. For moderate risk clients, again, answer no to all Part Q questions and are asymptomatic with 2 or more risk factors. It is not necessary to have a current medical exam and current exercise test for moderate exercise. It is recommended that the client has a current medical exam and exercise test for vigorous exercise. Physician does not need to supervise a submaximal test, but should supervise a maximal test. Again, start with the blood pressure and start slow with moderate exercise and build up. This is the safest way and it gives you the ability to monitor the client. For high-risk clients who answered no to all Part Q questions but are symptomatic with known cardiac, pulmonary, or metabolic disease, the client should have a current medical exam and exercise test before starting any moderate or vigorous exercise. Physicians should be present for any submaximal or maximal exercise testing. Again, starting with the blood pressure test, and start slow and build up, keeping a close eye to monitor the client while exercising, and the physician should be present in case a problem arises. Things to remember are, of course, again, to always start slowly and build up intensity. This will ensure the client is safe and enables close monitoring of the client. When in doubt, refer out.